And ambulances are running around the clock. The Mecklenburg EMS agency known as Medic is stretched thin. A few weeks ago, we told you Medic was enforcing mandatory overtime because of short staffing.
And it is not the only one to do this. New at 6, WCNC Charlotte's Chloe Leshner sharing the state is now requesting help from FEMA to fill in some of the gaps across North Carolina.
Medic needs more help. The mandatory overtime has helped keep them afloat, and they're still able to fully staff a shift, and response times have not dropped, but the medics are tired.
Okay, repeat that address just to make sure I have it correct.
In an emergency, they're the ones who help.
I'm sending the paramedics to help you now.
But now Medic is sounding the alarm.
They've had some staffing issues and need some folks to drive ambulances, but obviously not just anybody can drive an ambulance.
Call volumes are up to pre-pandemic levels. Plus, there's been an increase in COVID patients. With less people going into the field, they're short-staffed. Medic has requested more resources through local and state offices of emergency management.
We have requested some additional support there. We have not heard, anything final about what we might be able to expect here.
Mecklenburg County isn't the only place feeling the strain. The state sending this request to FEMA, asking for 50 ambulances and personnel to staff them.
Resources are strained, and so when FEMA offers help, we say yes, there are certain places where we have asked for additional help.
If FEMA does step in, the state's plan is to spread the ambulances out regionally so that counties can call on them as needed.
They do have processes for how they prioritize where they send people, but we'll continue to look for that kind of support.
Again, response times have not been impacted by this yet, but Medic officials say they want to be prepared in case the situation gets worse so that people at home do not feel the impact of this in an emergency. In Charlotte, Chloe Leshner, WCNC Charlotte.